Dear friends, in our introduction on hypertension, where we had to see the definition, we saw it in a very simplest way on how we can understand the pressure in the vessels. So we are going to continue now seeing the causes, specific causes or predisposing factors that would cause the development of high blood pressure. Let's see it again in a very easy way, summarized, short, hoping that is going to make things more clear by going slowly, uh, trying to use simplest terminologies so that we can understand, so that everyone can understand. If you understand it, that is the way to go, so that we can beat this serious problem called hypertension. The definition, we already saw it, and we saw the reference values. We saw when we start saying hypertension, what is normal value? When is it severe? When can it start causing serious complications? We saw it in the introduction, and now let's see the cause, the different causes, predisposing factors. Things that can increase your risk to get high blood pressure. One, smoking. Smoking cigarette, why? Because it has a lot of toxins, which will go and interfere with blood vessels or even damage blood vessels. It can damage the blood vessels all over the body, also on the heart. So the cigarette smoking has a lot of toxins inside. If you smoke it over and over a long period of time, for sure, the damage is inevitable. So this is known to be one of the causes or predisposing factors. Overweight. Now, remember in the introduction we saw the components that will make high blood pressure to be severe. We saw the pipe, we saw the generator, and we saw the water, the three components. So in our context now, these will interfere with the pipes. The smoking will destroy pipes. And the overweight will interfere with what? With the pipes, which are the vessels. In which way? We'll see in more details as we are approaching the next slides. Here, when we see the age, we remember if one gets older and older, again, the pipes, the vessels will get stiff and stiff, a little bit harder than before. The flexibility will be decreasing, if you eat too much salt. I like to give example of onion. If you take onion, you cut it into two. After cutting it, you take salt, you put on one piece where you have cut. The other one, you leave it without anything. The following morning, the water will be drained in the one where you put salt. Why? Because the salt has the capacity to attract water. The salt will attract water to where salt is. So what is happening is we eat a lot of salt. It goes to the intestines, it goes to the blood vessels. So the next step is to suck all the water in the tissues, in the muscles. Once the water is attracted now, it is going to fill in the blood vessels. If the water is full in the blood vessels, the volume of blood is going to increase. If the volume has increased, it will increase the pressure inside the vessels because the volume is too high. That's why when you have too much salt, you have eaten a lot of salt, you get thirsty because the salt has already drained water in your system. Then the body starts complaining that you are thirsty. So this is how the salt can be also another factor to contribute to increase what? Hypertension. When we don't do enough exercises, remember the blood vessels should be elastic. They should be flexible. They should dilate. So if you don't do exercises, then they get stiff, they get harder, they don't dilate easily. It will be the same way as one is getting older and older. So that will cause the vessels to be hard. So if they don't expand enough, so the pressure, the heart has to push harder so that the blood can pass. So that will cause what? Hypertension as well. So we are putting a long list of what? Of predisposing factors, including the causes together. So eating less fruit and veg. Fruits and vegetables, they have a lot of proteins, vitamins, and minerals. Minerals that are very important in the reconstruction of what? Of the blood vessels. Those are the source of the constructing material to build the blood vessels and also to cause the heart to function very well. So if you don't take this product enough, then you are having an added predisposing factor. So if we don't sleep enough, we are always tired. The brain will be tired, which will eventually has an impact on the heart as well. The heart has to pump fast. It's a fight. You are on a constant stress. You are disturbed. That would go into anxiety. Then the constant stress will affect the whole body, especially on the heart, which will cause also high blood pressure. People who take a lot of alcohol and caffeine. Caffeine is known to cause the heart to beat fast. If you take too much of it, it becomes a problem. Alcohol itself is known to be toxic, the way cigarette can be. So we know what we call cardiomyopathy, alcohol related. So there are some heart diseases that are caused by the alcohol. Alcohol can damage many organs, including pancreas and the other organs as well, even the liver. So if one has a diabetes now, as part of diseases, diabetes has a tendency of having interaction, okay, with hypertension. Hypertension can affect or cause the development of diabetes indirectly, same way with diabetes as well. Remember, if the vessels are damaged, then the body will fight to try to repair. So those will be exposing to the hypertension as well. Kidney disease. There are very important hormones in the kidneys which can regulate hypertension, blood pressure. If these hormones in the kidneys are disorganized, then it will cause hypertension, especially if it's a long-term kidney infection where the areas which produce the hormones on the kidneys are damaged. Or you might have what we call obstructive sleep apnea. If you sleep at night, you get blocked. Here, mostly when you are obese, you are very big, and the tissues in the throat, they are relaxed during sleep, and when they collapse, they will cause apnea. You lack oxygen. The airways are blocked. The air is not entering. So if you can't relax, then you have to keep on waking up. This can expose to high blood pressure. So the narrowing of the arteries supplying the kidneys, like what we saw, if the kidneys, the vessels inside are narrow, then the body has to fight to try to raise what? The blood pressure. The hormone problems. There is a hormone called aldosterone, which normally fight to prevent to lose water in the body. If this hormone is elevated, it will attract a lot of water. It will attract a lot of water, like especially what we call hyperaldosteronism. Okay, aldosterone, if it is too high, it will cause a problem. Pheochromostoma is a type of tumor, the tumors that will go and affect the kidneys. So the kidney has a big role, a very big role in controlling blood pressure. If blood pressure is too high, the kidney has to intervene. If it is too low, like in shock, for example, the kidney has to fight. It will release some chemicals, the hormones that we can study in another topic. So as we spoke about salt, that is meaning too much salt. If you eat too much salt, a problem will come. We remember we said that salt can attract water in the blood vessels. So the good man here was saying, please eat less salt. That was advice that was being given, written on the salt here. If you don't exercise, we understand the vessels will not dilate enough to allow the pressure to be the medium, to allow the vessels to dilate, so that the pressure, the blood can pass smoothly. Sugar, unfortunately, though sugar is so sweet, though sugar is so nice, it tastes good, but when it is too much, it will transform itself into fat. We remember the body has a limited amount of sugar that it needs. So the body will take the sugar that it is in need of, the rest it will transform it into fat. That's why people eat a lot of sweet chocolate, cake, too much non-stop, they will become obese. Sugar, anything containing sugar. Sugar is good as long as it is moderate. But it would be much better to take sugar from the fruit without even going to the refined sugar from these factories. We cannot forget fat. Fat, oil, people eating a lot of fat. Fat will go and pile up. And it will pile up in all parts of the body, not only on the chest, on the abdomen, on the back, on the arms, but also in the vessels. Remember we spoke about the lumen, the size of the pipe, so that the blood can pass through without struggling. So if the lumen is too narrow, we can understand clearly that the heart has to pump hard so that the blood can pass. Sometimes now this narrowing can be caused by clots of fat, the fat which will go and block the fat itself. Or if the fat is just surrounding the blood vessels, how can the blood be able to expand? And we know that the blood vessels should be flexible, elastic. And now there is something packed around it, it cannot expand. So that's how fat can be a problem. As we are continuing with fat, we know fat, especially the bad one, comes from meat consumption. Not only from pigs, but all meat, particularly red meat. Red meat is known to be the cause, the predisposing factor, with bad oil coming from the meat. So people who eat meat non-stop on daily basis, they are at risk. They are at risk. We need to know that. We need to face the truth. We need to tell each other the truth. It is well documented. You can read it. You can find it. Cigarette smoking, we saw that it can destroy what? The blood vessels. Cigarette smoking, depending on how much you have been taking and for how long. Imagine if this person is taking 20 cigarettes per day in 1 week, it's already 140. In 10 months, in 1 week, then in 1 month, it will be 140 times 4. It will be almost 600. Then in 1 year, it will be about 6,000 cigarettes that are consumed. So we can understand now if there are toxins, what they will have done in 1 year in the blood vessels. Thank you for following the part 2 on this presentation. We will follow with part 3. I'm inviting you to follow it. Don't miss it so that we get full in complete presentation. Thank you once again for willing to be part of this project that we believe it could bring about change. Thank you.